In this video, I'm going to talk about what the best position for sleeping with back pain is, and also one of the big mistakes that a lot of people make when trying to find that right position. So watch the rest of this video and I'll explain everything. So number one, if you have back pain, focus on the day. This is the biggest mistake that people make. Focus on doing the right things during the day. Focus on not sitting with bad posture. Focus on engaging your core and strengthening your core. And if this has been going on for a long period of time, you really need to get some treatment to help deal with the back pain. And we can help you out with that, just contact us. But when it comes to sleeping with back pain, you want to sleep in a position that is putting the least amount of stress on your back possible. Now, commonly you'll find that sleeping on the side is the most effective way. So when you sleep on your side, you pop a pillow between the knees. Why does this work? Because as your legs drop in, your glutes tighten, and that pulls on the lower back. When you pop a pillow between the knees, it opens the legs marginally, and that eases some of the stress on the glutes down here, which means it won't pull as much on the lower back. The second thing you need to bear in mind when you're sleeping to try and avoid making your back worse is sleep in a position where your spine looks like this. Now in the clinic, we measure people's backs to make sure they're in the right position standing. And I haven't measured this one, but it looks about right. It's got a nice smooth curve going through it. The top is over the bottom. The rest of the spine is missing, but we won't get into that. And that's the position you should maintain when you're sleeping. Don't curl up like a fetus. Lie there in a neutral position. The spine in its most comfortable natural position, so it's not got any stress points on the side or on the back. And that is the best position by far when it comes to sleeping with back pain. But as I said at the start of this video, try and make the changes during the day, because it's hard enough to get patients to do the right things when they're awake, let alone when they're sleeping. And if you're a mobile sleeper, if you flip and turn and toss, etc., you're going to struggle with finding the right position because you're just one of those people that moves a lot at night. So focus on what you can do in the day that's going to help your back pain, whether that's get treatment, whether that's do the right exercise, whether that's using ice, whether that's not sitting at the desk for too long. And that will make your night's sleep an awful lot easier. Another little tip, which isn't about sleeping, but just before you go to bed, is move around. A lot of people, when they get in from work, they go and sit and watch TV all night, and you let that back seize up, so it's been still for the last 2 or 3 hours before you then go to bed and stay still for longer, and that gives chance for this inflammation to build up while you sat there watching your favorite series or films or whatever. So get up just before you go to bed, have a little walk around the house. Stay upright, get a little bit of movement going, not too much forward bending or backward bending, but just walk around. Do a few bits and pieces for 5 minutes and then get into bed. That can make a big difference as well. So follow these tips, and if you need any more information or any more information on back pain, neck pain, those sorts of things, hit the subscribe button somewhere on the screen now or somewhere on this webpage, and you'll be able to be up to date with all the latest back and neck pain related advice.